Okay, hello there. I'm Dr. Paul Richardson, and with me, you'll see in the corner, is Dr. Ryan Pearce.
Hello, everybody.
And today we're going to talk about gamification and clinical debrief. The main thing we want to get across is the benefits that it can bring to clinical debrief to really lighten them up and make them a more enjoyable environment for your students, but also yourself, and how they can get a lot of benefit out of gamification of learning when used appropriately. So how we're going to do this video is, first Ryan's going to talk us through some of the pedagogy behind gamification. I will then lead us through some games that I personally use in clinical debrief, and Ryan will chip in with some examples as well, before Ryan closes with a few key messages to take home. So Ryan, over to you.
Well, thank you very much for that. I think one of the most interesting things regarding education and games in education is that they don't fit traditionally into the VARC learning styles. As a refresher, VARC stands for visual, oral, reading, and kinesthetic. And often people have a preferred mode of learning. Some people can be multimodal, but often games don't fit neatly into any one of these particular categories. And due to that, often they've been dismissed as being uneducational and not of value over previous decades. And often we really haven't used them to their full potential. Now, what we do know is games do work when you're younger. And we'll see on this next slide here. When you're young, you learn extensively through games. You've got some children who are playing shop, and what this can help with is item identification, customer interaction, even basic arithmetic, identifying a cost, some subtraction. And on the right, you can see some children playing together, problem solving, constructing a train set, but they are learning through play. Now, this was only formally recognized late in 1901. And it's recognized that if you increased engagement, then if you gamify something, turn it into a game, you increase engagement. And it was the Boy Scouts who did this. The use of badges was something that they implemented. So rather than escorting an old lady across the road, for example, and having a sense of well-being, if you did it 5 times, you got a badge. If you got 10 badges, you became your troop leader. And adding this element of competition increased engagement. And it was one of the first formally recognized elements and uses of gamification. But it probably predates all of this. In ancient Greece, there was riddles, which were used as a crux of education, and they were going back thousands of years. Probably the most successful gamification use to increase engagement was in the 2016 game Pokemon Go. Now, the reason I'm pointing to this is Pokemon Go was a fantastically addictive game, and it used lots of elements of competition, such as stimulus, repetition, interaction. A study showed that if you collected all the 150 Pokemon, there are now up to 800, but if you collected all 150 with they evolved from something into something, and they all had strengths and weaknesses and 3 attack modes, students were able to recall 1,500 bits of information. Now, I've put this onto a chart, as we can see in the next slide here. That is how much information they had to recall, and most of them who played this game could recall over 90% of it. If you compare this to the periodic table, which is 150 elements with 2 aspects, an atomic weight, sometimes an atomic number, most students would just despair at the thought of trying to remember the periodic table, because it does not inspire engagement. It is not interactive, and it's very difficult to gamify. So this just demonstrates if you can gamify something, then it's very possible that students will engage with it and they will improve their attention. This is very much societal-based evidence, though, and we really want to look at the evidence in medical education itself. So if we just go over to the evidence. In 2017, there was a systematic review done for the use of games in medical education. It was done out of Italy. It was done by a person called Bagatta, and they found that there were 496 papers looking at medical education and how gamification can improve this. Only 21 were found to have been good quality medical games. A lot of them were quizzes, a lot of them were rote learning, and none of them were done in the UK. None of them encouraged lateral thinking and problem solving. So really what you have to do is you have to look at the wider educational society. What I've got here is a systematic review from Italy, which is done in physics in higher education, and they used a virtual reality model, and abstract concepts such as sine and cos and tan and other things that I don't understand at all were explained and understood a lot easier in virtual reality and real life and games. Following on from this, the students who engaged with the VR headset on average scored 10% higher in their final exams than the ones who did not. And in Texas, Austin University in Texas, mathematics engaged with gamification, again at higher education level, and every student who engaged passed the degree as opposed to those who did not. So they're probably the two biggest studies that demonstrate that, that it works. A final systematic review was done last year, and this demonstrated, it compared gamification compared to normal rote learning. And it concluded that it was not superior, but probably equivocal. And it was a very useful modality to have. So it was not to replace classical teaching, but it was an excellent adjunct. And I think that's how we've got to view it in Clinical Debrief, as something that we can throw into the mix, something after lunch or after the students are getting a little bit tired to re-energize them and to rejuvenate them. And I think it can be used exceptionally well. My students have certainly enjoyed it. I tend to use a lot of the games that the university provide, but I know that Paul has got quite a creative license and has made some of his own. And I think he's quite happy to share those with the budding clinical debrief tutors. So Paul, if you want to run us through some of your games.
Absolutely, right. Thank you very much for that.
Okay.
So to get you started with using games within your sessions, the university actually provides you with some resources to start playing games. So if you go on OneMed and you click on this CD tutors part, scroll down to Year 3 Clinical Debrief, scroll down to Clinical Debrief Tutor Resources, and then if you see on the right here, Preparation for Practice, also Preparation for Placements and Games, click on that, and it's got a few games for you to try already. Now, the first one, the one they've got most links to, is the Define and Shine game. Now, there are many ways to play this, but the way I personally find best is when you click open one of these, it'll have these words in boxes. If you print them out, cut them up, obviously in advance, and then I bring them in just a little envelope with some sellotape. And you split the teams, you split the group into two teams. And on one side, you obviously have to explain this in advance. You get one of them to come up to the middle, and they turn around, and you've got lots of sellotape ready, and they haven't seen these words, and then you sellotape them onto their backs. Then they go back to their groups, turn around to show the rest of the team the word, and then the rest of the team have got to describe that word to the person with it on their back, and then they will then obviously try and guess it. Usual rules for this kind of game: so no sounds like, no begins with, no it's this many letters, and you can vary that as well. So sometimes I might say that there should be no medical terms. You should just use layman terms only. Sometimes I say, use what you want, but you're always listening to both groups, trying to make sure they're both on track and playing fairly. And what often happens is it brings out their competitive side, and they get really into it and trying to explain it. And without realizing it, they're actually talking through some medical terms and ideas to each other. And some of them might not understand fully, but then, just by talking about it, you start developing that recognition. And once they get the word, they come back to me. and I'm ready with a few terms already with sellotape ready, and then I can just stick the next one on the next person's back. So it's not the same person coming up guessing. I rotate it so they just take it in turns, trying to guess the word. I just use a random mix of words, and I try and keep track of how well they're doing. So some words might be more difficult than others, so I'll try and roughly gauge it and move the words around in that order. But as a rule, it's random, and that works well. It really gets them engaged, and it's a brilliant, especially the history examination words that I've got up in front of you. It's a really, really good one to use for the September starters, because they're general words. Most of them are relatively simple. They would have heard of from a medical perspective. If you look, through signs, symptoms, pathology, these are all words that they should know about, but they might not know all of them. And as long as they get the word, they don't need to know 100%, because at the end, what I do is we sit around in our circles as normal, and I have the whiteboard, typically what we've been using to write the case on. And I get them to, I split the board in half, and then I get them to put, say, 3 from each team onto the board. And then we talk through what they mean. So, if someone puts drug history, that's pretty obvious. We don't really need to go into that. But then one of them might be non-invasive tests. And then I'll say, okay, what do you think non-invasive tests mean? And we might talk about what's an invasive versus a non-invasive test. And then you'll throw something that kind of sits in the borderline. So, okay, what about a swab? Do you think a swab is an invasive test or non-invasive? And if they say, it's not invasive, I'll say, well, okay, what about a vaginal swab or a penile swab? And throw it around. Or if they say it is invasive, okay, so would you say that a swab just on a fingernail would be invasive? And that way it gets them thinking about what the definition is between an invasive or non-invasive test. Now, if we go back, you can see that they've got 10 different categories for this. And I have them all printed out, cut up, ready to go. And then during clinical debrief sessions, if we have a case that we're talking about, say, a hematology one, then I've got that ready as an extra game we can do at the end. Now, don't get me wrong, I'll have 10 printed out, and I might use 2 throughout the whole session with one group, because you don't want to overuse one game where it gets too repetitive and they get used to it. But just by having them all ready, it means if you are talking about a case that might be about pneumonias, then if you play a game that is based around pneumonia, that aids their learning, because it just reinforces what they're talking about and opens up more avenues for discussion around that topic. So that's the define and shine, and that's the main one they've got on there. There are lots of others, and obviously you can read through them yourself. Medical hangman, that's pretty obvious. Just hangman with medical names. So that's where you've used a common game that people have used in a medical setting. Doctor's bag, that's another good one that I've used, where you get them to write out what do you think should be in a GP's bag, in a GP's visiting doctor's bag that needs to take to every home visit. And then you can talk through what they've got, why they've got it, when it might be applicable, once they've designed their bag, and then discuss other things they might have missed. Now, we know that every GP's bag is actually probably slightly different, and we all have our own bag and the way we set it up. So I use my personal experience and talk what I found, and then also might mention about one of my colleagues what they may take, which I don't take. And you can discuss about the rationale about why one's good, when will it be useful, when it's not be useful, what's the likelihood of using certain things. So that's a good one to kind of talk through. And they've also got in here an abbreviations and acronyms quiz. So as we can see here, this is an abbreviation quiz that I've made for my students. Now, the first year I did an abbreviations quiz, it purely came on the back of one of the students asking me about an abbreviation they'd seen in the notes and they didn't understand. So they drew that abbreviation out, and I realized it meant fracture. We've also seen the hashtag for meaning fracture in medical notes. And then I took that opportunity. There was only 20 minutes left or so in the session to ask about a few other abbreviations. Some they knew, some they didn't. And then I turned it into a quick game for the last 10 minutes of simple me writing it out and then them shouting out if they knew the answer. Going forward, I thought it's going to be easier if I have something ready for each group of students I come across if we choose to do this quiz. So I made this abbreviations quiz that you can see on the screen in front of you. Now I put it into categories. So history will be the first, and this is just a nice slide just so you know it's the first category. And then this comes up, this slide comes up, and it comes up for 12 seconds, which might seem like a lot, or maybe it doesn't, I'm not sure. But it is quite short, particularly if you're not confident on the answer. So there will be a rush, but at the same time, it depends how many abbreviations you have, but often you can think of a few, and you'll want to get through quite a few. So I found 12 seconds seemed to be the sweet spot. So it might do SOB for shortness of breath, MSK, etc. And then I put in these catch-up slides. Avoid me having to pause it, give them time to catch up if we've done quite a few in that section. And then it still runs every 12 seconds, but it looks to them like it's counting down, so it just makes it look a bit slicker. And then the next round might be examination, so HS. Now, the good thing about this is because you put it into categories, such as history, examination, it gives some grounding as to where they might see it. So HS, you might not necessarily know, but when it's an examination, you're pretty quick to say, okay, that's heart sounds. And that's pupils equal and reactive to light. But outside of that, you might not have known. So that helps ground them. And I think I've got drugs and I've got general knowledge as well at the end for the few that don't fit into any kind of category. So that's a fun one that, again, that you can quickly make and then have in the in your locker ready to use if it's appropriate for your session. One way I tend to work this in is towards the end of my sessions with each group of students, so around maybe week 10, is instead of getting one of the students to write, I'll write on the board, but I'll try and use as many abbreviations as possible. And often what you'll find is I won't explain them, but students might not necessarily question because they were just talking about shortness of breath and I just wrote up SOB. And so they might clock it at the time, but then forget it. And then when it comes to the quiz, usually one or two of the students will realize that some of the abbreviations in the quiz is actually on the board. And that's absolutely fine that they can reference stuff they've already come across to use on the quiz. I personally tend to split the groups into two if I can. It seems to work best for me, but you can do it any which way. So if I go on to another game that we've got, this is a confidence game. And this is an example where there are games out there available to buy, and it's about adapting a game you may have come across to use for medical students. So in this game, how I phrase this one, it's first to 15 points. And you may know roughly that the lowest recorded resting heart rate might be in the 25-35 region, but you're not very confident on it. So instead of giving an exact answer in this game, you give a range. So you might put 20 to 45. That's a nice big range. You know you're going to get what you should hopefully get it in that range. And if you get it right, you'll get a point. However, to give that competitive edge and make sure they're not just guessing silly, the person who gives the smallest range and is correct gets 3 points. And trust me, having played this game a few times, you cannot win if you're getting 1 point every round. So it really does encourage the students to try and think about what they think the lowest resting or human heart rate is and try and get that range narrower. And it's a really fun way to do it. And often what I do is I get them all to write it down, or typically now on their iPads, they'll write the answer down. their range. We'll reveal at the same time, and then I'll say the answer, and then I'll keep a tally of the score. Using these games is excellent to really engage them. And I found really to get the most benefit out of them, at the end of the game, you will discuss what was the learning point from that game. So for example, a good example in this case is I've got some questions here about what was the population of the United Kingdom and what was the population of Greater Manchester. Now, if a student comes across that, they might, and I say, what's the learning point there? They probably will think, nothing, it was just a nice fun quiz question. But then you can relate it to something that they know. So if you know a disease has a prevalence of 1 in 100,000 cases, and you know there are 2.7 million people in Greater Manchester, you can roughly work out how many people have that disease in Greater Manchester at any one time. And so by giving them those few key learning points at the end, hopefully you have that nice kind of realization moment, typically, where you say, oh, well, can you work out how many people are in Greater Manchester having a go? And work out, oh, right, okay, so there's actually, about 50 people. So that's how common it might be in my area. And we're obviously training in Manchester and with a view to hopefully working in Manchester. So that's why it's applicable. And that's using the games to the best of their ability and getting those learning points afterwards. Now, one key thing I will say about gamification of learning is it's about getting the group sizes right for the games, or the games right for the group sizes. So if you do a quiz like this and you do it individuals, then in this case it will work quite well because they're writing down and it's not a shout out answer. So that, as individuals, this group one works quite well. If I go back to the abbreviations quiz, the problem I found the first time I did it, where I was just doing it off the cuff, was that the confident or allowed people would always shout out or guess the answer first. And I had one student who was particularly quiet. And in that kind of environment, they're always going to stay quiet. So one way around that, when you think about making your games, if you stick to the ones that have been provided by the university, or if you make your own, which I'm always encourage you to do, is you have to think about what group size you're going to have. If you're doing it where everyone's answering and everyone's shouting out, then the quiet students are going to stay quiet. If you do it in individuals, if you do it as a whole group. If you do it in individuals, the problem there is there's typically 1 or 2 more studious students than the others, and they will typically always lead the pack in kind of winning these games. So what I found best is splitting the group either in 2 or in pair 2s or 3s, depending on the size of group that you have. And that way it gets some cooperation going. So they're talking to each other about each question and about each answer, and it helps stimulate that thinking through the question. And it means quiet students aren't shouted out by louder students in a big group. And it gets everyone involved giving answers. And ideally, I try and avoid the shout out first type of game, and try and structure it in a way where you're writing the answer down, or some other modality, or taking it in turns, or however you may do it, to make sure that everyone gets involved and we don't get a too lopsided game towards particularly intelligent students or particularly loud students, or whatever it might be.
Great, thanks for that, Paul. One example that I was particularly keen to talk about is a game we've created called Backronyms, which is an acronym of backwards acronyms. The premise of this game is you reverse engineer an established medical acronym to decipher what each individual letter would stand for and why it is important. So the classic example of this that I used to explain it to other tutors would be CURB 65, which is a prognostic indicator for pneumonia. and it stands for confusion, urea, respiratory rate, blood pressure, and age over 65. Now, most students won't have come across this before. And what you do is you give them the score, curve 65, and tell them there's 5 parameters, and it's a prognostic indicator for community-acquired pneumonia. What could they stand for? And the students will discuss as a group in 2 separate teams and come up with what they think it could be. Often they may say that C could stand for confusion. They usually get that one right. But the 65, rather than being age, they might think it is weight less than 65 kilograms, reflecting frailty. And the R might be raised heart rate. So you give them a score out of 5. So, for example, you give them 3, and you give the other team 2, 4, however many they've got right. And you tell them to revisit and reassess what they've got and determine which ones they think are right and which ones they think are wrong, and substitute some in. Often you guide them along the way, and it's the first team to get all 5 right is correct. But by the end of it, one team will have won, but the others will have critically appraised the parameters and will have realised why tachycardia isn't a good prognostic indicator, because it would go up with pyrexia, which has got very low prognostic value, whereas increased respiratory rates has a very good prognostic indication, is a very good prognostic indicator. And they do learn an awful lot. And a small study that I've done just by myself, comparing different clinical debrief groups that I've had, is that if you teach them the curve 65 score this way, they retain it a lot better than if they've learned it via a traditional rote method. And this doesn't really have that many limitations. As long as you've got as many games as this, as you've got medical scoring systems, and there are hundreds available. So that is one that I really enjoy using with my students, and I think it's creates a good amount of energy in the room. I think to wrap up, we're just going to look at the 3 big key points that I'd like to really emphasise as take-home messages that we've learned from using games for medical students. Number 1 is keep it dynamic. You'll create a game, you'll have an idea, but I've not had a single game that the students haven't improved. They will take it, they will run with it, they'll say, well, can we do this instead of this, or this instead of this? And almost always the improvements mean involving me less. They want to be the markers, they want to be the assessors, and they want to modify the game. So keep it dynamic and keep modifying it as it goes along, and keep it fun. But being flexible and versatile is one of the most important things. The second lesson is going to be failure. These games, some of them will fail, but that's fine. You're creating. But the students, if they do get them wrong, they enjoy failing in games. It's very different to an exam. In an exam or a test, you answer, you submit, you wait, you ponder, you get a result, and then you have to re-revise. In a game, you try, you fail, you try again, you fail, you try again, and it's just like learning to ski. And anybody who's a beginner skier has more fun than almost anybody else, and they fall over so much, but it's just that instant repetition and instant feedback. So don't be afraid of the students failing these games. They will learn from it. And the third key take-home message is going to be that these games, they're not meant to replace critical thinking, rote learning, critical appraisal. They are an adjunct, they are an extra, but the evidence does support them as an extra. So use this tool that we've got, be creative with it, have fun with it, and I'm sure you'll have a great experience teaching your students in the future. This lecture and lots of links to the games we've created are going to be available on OneMed, and your clinical debrief buddy group and your supervisor will also be a great source of support for the gamification needs. Thank you very much for your time.
Excellent.
And,
thank you very much.
Good luck. Thank you very much. Bye.